an extension worker?
My name is Calvin Oriwa. I'm a chief from Tom Mboya Health Center, Community Health Extension work. My main fundamental work is to act as a linkage between the community and the facility. And also to help the community know more about the facility and the facility know more what's being perceived in the community.
So what's your difference? You're an extension officer, but you have the community representative. What is the difference between you and the community representative who sits in the Health Facility Management Committee?
Community representative?
Yeah. You're aware we have the health
management team.
Yeah. So what's your difference between an extension officer and a community representative who sits in that committee?
Community representative. They work in collaboration with the facility management team they plan together. They act as a team, but they don't represent the real thing in the community.
Okay. Yeah. Okay, so that is where you come in.
For me, I'm a linkage between. I coordinate most with the community. Know what's their problem. Know the real problem in the community, and then report them to the facility. Then I present the problem to the facility management team. We talk to them as a team. Then I give them the feedback through health barazas and the chief barazas. Okay.
So what would be your main challenges so far in terms of the service delivery in health centers, in this specific health center?
This specific health center service delivery is still below part the community need.
So could you indicate some of those challenges?
The challenges we face mostly is the lack of drugs. Lack of essential drugs being offered to the community.
So you could say, do the drugs get to the health facility and then the health facility does not distribute, or the drugs do not get to the health facility at all from the national warehouse?
They normally get to the health facility, but not full enough to serve the community.
Okay.
And then we normally have insufficient drug supply. Sometimes normally drugs come by the time the demand is higher than the actual supply.
Okay. Okay. So how would you advise to remedy some of these problems?
To remedy the problems we normally have to look first the kind of problems the community is facing. Like the real problem is the community is facing. Like Nyanza is a malaria-prone area. Most of the time we have malaria problems. Sometimes you are being referred to go and purchase the drugs in the district of Beta, so that you can come over and get treated.
Okay. Okay, so right now we are doing a study on pharmaceutical and access to pharmaceuticals, as well as access to, in terms of distance and information in the health facilities. So we're also looking at empowerment levels of the citizens. So in terms of road, things like telephone, TV, radio, how are the levels of access for the individuals? Do they participate in discussions that go around in the country in terms of, from basic things like the health system to even politics and that kind of stuff?
Like for now, we have a problem. The facility for now, we don't have electricity.
Okay.
We normally use solar. And even the community, most people don't have even the access to. Maybe they have access to the radio, only radio, but not the TV.
Okay.
So most of the time, we lag behind the updates.
What about newspapers? How often do the people in the area get to read newspapers?
Newspapers, maybe if you go to the district, but within our locality, there's not even a single supply of newspapers.
Yeah. Okay. Thank you so much.
Welcome.